I particularly enjoy working with people experiencing what we call perfectionism. Often people have high standards for themselves, and it can be anxiety provoking for that person to not reach those standards. And it might not necessarily be that a person is aiming to be perfect, but to perhaps be outstanding, or to perhaps just achieve a fairly high level in their eyes. I think a lot of people suffer from perfectionism and perhaps aren't aware of it, and it can affect people in lots of subtle ways that can actually lead them to feel quite stressed out. So, for example, there might be kind of typical examples where a person wants to do really well at work. It might be that a person wants to do really well for their family, and they might have quite a black or white or all or nothing view about themselves if they don't achieve these standards, and it can lead people to feel really quite low and down. They feel like they've let themselves and other people down, or it can make them feel really quite anxious about what's going to happen if they don't meet these standards, and people can be quite catastrophic about the outcome if they don't perform well enough. I enjoy working with this problem because I think it's a problem that actually underpins depression for many people, and lots of anxiety-based problems as well. And it might not be necessarily that a person meets clinical criteria for depression or anxiety, but it could be that perfectionism is hindering them and kind of making them feel under pressure and stressed out. So we can work with that and look at, okay, so what would be a reasonable goal for you to have for yourself? Really, how catastrophic would it actually be if you didn't reach this goal? And kind of help people to see things in a bit more of a balanced way, and help people to have a more kind of sustainable approach in their life, a way that they can live their life a bit more comfortably.